much smaller country, 24 times slower than lower. I even slower, not lower than Japan, definitely. For those from other countries, the location of Slovakia is Central Europe, and is highlighted on the map. Basic data on Slovakia. Slovakia has around 5.5 million inhabitants. Population density compared to Japan, as you heard, just is lower. It's about 100 people per square kilometer. And gross domestic product is about 12,000 euro per capita, and average monthly wage is 750 euro. So you can compare it to Germany, speaking of 4,000. Healthcare system in brief. Healthcare system in Slovakia is neither Bismarck nor marriage nor national health insurance model, as we have heard in the UK, but it has certain features of all the systems, and in some way it's similar to German contributory healthcare system. Contributions are mandatory and are paid to the health insurance company of the health insurance company of choice. Almost 100% solidarity is implemented in the system. That means that well, people who earn more pay more, but there is a limit. So if you earn more than 2,000 something euro, then still you pay the same amount of money per healthcare than anyone who earns 10,000 or more. So that's the reason why there is stated almost 100% solidarity. There is a limit. And so you don't pay more money if you earn above the limit. According to data from health insurance companies, over 98% of the population is covered by healthcare insurance. And virtually, an insured citizen is not limited as for the healthcare spendings, but what is set in healthcare as a reimbursement limit for the healthcare providers, and that creates a basis for the problems, because if you go to your general practitioner or you ask for tests in the laboratory, you may have a problem because the healthcare provider is not reimbursed because of the limits. But this is not necessarily your problem as an insuree. So this is difficult, and it is discussed in Slovakia all the time. In brief, an outline of components of the Slovak healthcare system. We have 4 medical faculties, 3 health insurance companies, 1 state health insurance company, and 2 private. In outpatient offices, we have around 8,000 medical doctors. In total, in Slovakia, we have 21,000 registered medical doctors. That's Slovakia's medical power. We have around 180 laboratories, 68 hospitals, and 1,600 pharmacies, which are supplied by suppliers. As for the public healthcare spendings in 2009, similar numbers are holds also for 2010. We have spent, from the public healthcare, we have spent about 5.26% of gross domestic product, and in absolute number it's 3.4 billion euro. And additional healthcare spending in cash, that is the money that is paid by people in pharmacies and other healthcare providers. It's additional 1 billion euro. So in total, that makes about 7.5% of GDP, just to let you know, so you can compare to other countries. Mobility in 2009 in Slovakia. This is interesting that I noticed in the presentation in the United Kingdom that this is similar to what you have just presented. Around 78% of the population do feel healthy, and that was done by by survey in 2005, similar as in the UK. And according to these numbers, from morbidity point of view, probably this is from 2009, and those two numbers are similar. So that's why I've stated that around 78% feel really healthy and 21% ill. So you can see what diseases are most frequent. It's cardiovascular disease, diabetes, and all other. Cancer represents, from the morbidity point of view, only 0.47. But as the cause of death, so from mortality point of view, here we have cancer is 1/4. And the most frequent cause is, of course, disease of the circulatory system.